you are not your diagnosis.
Right.
Right. I want to emphasize that because I think a lot of times people can take on this identity of whatever it is that they're diagnosed with. And I want to emphasize the point that you are much more than that.
Welcome to another episode of WeDriveHealth podcast. I'm Dr. Nate, DNP, CEO, and founder of WeDriveHealth, and we're all about steering health forward. Today, we're joined by Dr. Dexter Daniel, who's our mental health therapist, and we're going to have a beautiful, riveting discussion about mental health.
Yes, we are.
Yes.
Thanks for having me, man.
Thank you for coming through. We appreciate you.
Appreciate it.
Yeah, so mental health obviously is a very important thing that we continue to highlight and showcase everywhere that we can, social media, in our primary care visits as well. So Dexter, tell me a little bit about what you've noticed about patients when they come and see you, or clients when they come and see you. Do you feel like they understand that their body works holistically? Mind, body, soul, do they understand that concept?
I think that's a good question. I don't think they really understand it until we actually dive deep into what it is that they want to talk about. So a majority of my clients that come in, I would say that they experience symptoms of depression, symptoms of anxiety. And then it's almost as if when they talk to me about the central issue that they want to talk about, what they're experiencing on a physical level seems to be like a separate conversation. Or they seem to like mention it in passing, like, oh, I'm not sleeping well, or I'm not eating as much as I should, or I'm eating horribly, or I'm not exercising as much. But it seems to be like a very passive conversation when they talk about their body as a whole. But then I also have to remind them that, you know, your body is holistic. Like, it's not just about what you're experiencing on a physical level, but what you're experiencing on a mental level, or even like on an emotional level, is going to impact what you're going to experience on a physical level too. So it's really interesting that I have to remind people to like make sure you get enough sleep, make sure that you're eating right, make sure that you're exercising, because all these things, as you know, like have a direct impact on your mental health and what you're feeling and what your emotions are, right? So I would say that they have a general idea, but I don't think it's really at the forefront of their mind though, until like we actually have the conversation, and then I got to remind them what to do.
I think that's very interesting because in the primary care side, we see patients who have unrelieved pain or things that are just not resolving.
Yeah.
And it gets to the point where we're like, is this a mental health component? Is there an emotional component to this? Is there something else that we can do and offer our patients? To my primary care colleagues, what can you tell them about how to have a discussion with patients during the primary care visit that would allow them to feel comfortable enough to now kind of reach out to a mental health therapist?
Yeah, I think language and tone is everything, honestly. Like, we hear about white coat syndrome, right? People walk in, they see the white coat, then they're like, you know, they kind of freeze up a little bit. Even if they don't say anything, like internally there's something going on, right? Because they automatically assume, or they have this belief that, all right, something must be wrong, or I know I'm coming in here 9 times out of 10 probably that they're coming in here to address an issue. And that in and of itself can actually like drive up their anxiety a whole lot, because one, they may not know exactly what's going on, and they don't know what you're about to say to them as a physician too. So they're like, they could, you know, the physician could say anything from A to Z, and they don't know what it is. And I think the fact that they don't know, there's a fear of not knowing. And people are really uncomfortable with that. So I think when it comes down to interactions, let's say between like the physician and a patient, I think really just taking your time, like pause, right? And I understand like you got a lot on your plate. I don't envy you at all.
I don't envy you either.
I don't envy you at all. Like there's much respect for what you do.
Same.
And all you physicians out there for what you do. And I understand like you have a huge caseload, like you have a huge client load, a huge patient load that you have to get to in a certain amount of time. So you don't really have the time to spend with each patient to like really dive deep into what they're doing. Hence why you got to tell them what it is, see how they're doing, and then kind of keep it pushing. And it's not that you don't care, it's just that you have a lot on your plate. But at the same time, if there's a way that we can actually like pause for a bit and slow down for a bit, if it's possible, because I don't want to be disingenuous or not be mindful about what it is that you all go through on a day-to-day as far as like what you have to get to. But I think just showing the client or showing the patient that you really care and that you want to see what's going on and that you want to pause and like be there with them, even if it is for like a solid 5 minutes, like a quality 5 minutes, I think is much more impactful than 5 minutes of just like, yeah, you got this, that, and the third, do this, that, and the third, and then see me in 2 weeks, you know? And people will know like whether the connection is genuine or not. So I think in all how we spend the amount of time with our patients, with our clients, really go a long way. So taking a moment to pause, don't show that you're being so hasty or that you're in a rush, because I think people know this already, but still clients and patients, they're worried about what they got going on. So they're like, yes, we understand you got a busy schedule, but talk to me about what I got going on. Because, you know, any sense of dismissiveness or feeling like their time is being like rushed will, I think, further, exacerbate the feelings of anxiety that they have. And then I'll even take it a step further, even, you know, some symptoms of depression as well too, because they may not feel like they can talk to anybody about what they have going on. And you might be the first point of contact at that point in time. So it's really important that we do take a moment to really like slow down, have our moments with our patients, with our clients, that they feel as though that they're being seen, that they're being heard, and that they're valued as well too. So I think that's really important.
Now, I appreciate you saying that, and I think that's really the verbiage or the understanding that primary care is so busy that we are just so inundated with, hey, we got to kind of move along, make sure that we're seeing patients, but we still want to provide that quality care for patients, and we understand again that patients are holistic beings, right? So it's very important that you said that, maybe having that slow down moment, really participate in active listening, making sure that you're zooming into the conversation, try to understand the context clues of what's going on. I agree. So I think something that I adopted from friends who are in the mental health space, who kind of work in the mental health space, is how do I use my short period of time with the clients to decipher if there's something else that I need to point out to allow me to now refer them to somewhere else. And an exercise that they taught me, and I hope this is something that you think would be good, is I always ask about social support. Right? So, you know, I don't know if this is a good thing, but I usually tend to ask, especially men at a certain age, around our ages, about social support and what that looks like. Are there any other tips or quick tidbits that you can try to give us in the primary care world that are like red flags that will be like, you know what, probably we need to explore going to the therapy world for this actual patient?
No, I think that's a really huge one. And I know that you're good at it too, just because you're very personable as a person. And I hear like other people, as far as like your patients go, you know, the great things that they have to say about your interactions and how you really engage with them. But I think asking about their social circles and their networks and their support systems is really key. Because to me, I would think that's a red flag when somebody says like, oh, I don't really have anyone to talk to. So if somebody says that, then what that's going to tell me is that, oh, you're probably isolating then when you have something going on. And perhaps one of the worst things that you can do in a situation like that, especially if you're experiencing a great deal of depression or symptoms of depression, is to isolate. Like that's the last thing that you really want to do. And I think people have a tendency to want to do that. And, you know, I think I'd be a hypocrite if I said that I don't do the same thing myself. I need a moment to like process and see what's going on. There's nothing wrong with that. But when you do it for a long period of time, then that's when it can become problematic, right? So I really think that that's a really great question to ask, asking them, so tell me about your social support system. Like who's in your circle? Who's part of your village, right? I think village is especially, I think, a very strong and powerful word to use, especially being that, you know, we want to promote cultural competency in our work, right? Especially being Black males, or Black physicians, Black professionals in this field. And I think that in and of itself, language is power, right? So I think even in using that, what you're talking about or what you're trying to get at with your patient is talking about connectivity, which is integral for healthcare, right? Like you can't do this by yourself. You know what I mean? So looking out for that. I would strongly advocate for ways to physicians to incorporate screenings for depression and anxiety as a part of their interactions with their patients, especially if you're meeting them for the first time, right? I know that the focus primarily might just be looking at the physical symptoms that might be coming up. And then of course, like you ask about, hey, is there anything else going on? How you feeling? You look at people's blood pressures and you can assume like, oh, you seem stressed, like what's going on here, right? But I think if there's a way that we can formally incorporate these assessments into our interactions with patients, then I think that will actually bring up a lot more to the attention of physicians and primary care workers as well too. So I think those two things for sure. Just being mindful about that, incorporating that.
It's so interesting that you bring up this scale, right? Because we were all in primary care taught about this scale. But for the general population, can you talk to us a little bit about what this scale is that you're referring to, that we should be incorporating a little bit more into our practice?
Yeah. So one of the scales that I was introduced to, especially like when I was in grad school, was to assess for generalized anxiety disorder, right? So there's a series of questions that somebody would be able to ask a client, like when they come in, just to see like how would they rate, whatever it is that they're feeling at that point in time, and also like how long were they feeling that for too, right? So as mental health professionals, I'm sure that you guys use this as well too, as nurse practitioners. We know the DSM-5, right? Yep. So there's like a whole list of criteria that people have to meet in order to be formally diagnosed with something. Right. From my end, it takes a little bit of time for me to really feel comfortable with saying, okay, I think that this is what we're dealing with here. Right. Although I think in a lot of cases, depending on how the session goes, I'll find out within the first 15 minutes, like, okay, maybe this is what we're dealing with, right? Depending on how much details that they give me. But yeah, I would say one of the assessments for sure is just checking for generalized anxiety disorder, assessing for that. Like I mentioned, assessing for depression as well too. So very similar to checking for physical symptoms. We're talking about, well, what is it that you're experiencing and how long have you been experiencing it for? Right. So we as licensed professionals, heavy on the word licensed, know what it is that we need to be looking for and how to appropriately diagnose our clients and patients. But I'll even go as far as to say that you are not your diagnosis. Right. I want to emphasize that because I think a lot of times people can take on this identity of whatever it is that they're diagnosed with. And I want to emphasize the point that you are much more than that. Like this may be something that we're dealing with, but do not conform your belief or your identity of yourself based on what it is that we're talking about here or what it is that we've formally diagnosed you with, because this can be overcome. As long as you put in the work, as long as you're consistent, as long as you're committed to the work, then we can overcome this, right?
I love that. Yeah. So giving the patients some empowerment and control, that this is not, like you said, this doesn't define who you are. Because again, we're holistic beings. So there's a lot of things that are that come into play here. I do have one more good question that I know patients always. So patients show me that they have a little bit of hesitancy when it comes to discussion about them actually embarking on a therapy journey, right? And I think what I've been hearing a little bit more from patients, because I keep asking a lot of questions, is they probably don't understand the differences between a mental health therapist versus a nurse practitioner, psychiatrist. So can you just break it down for us? Simplest form, what is the difference between the two? And when I'm saying I'm going to refer you to these specialties, what should the patient expect?
Yeah, so I would say the first thing that comes to mind for me is that I'm a licensed social worker, so I have an LMSW, working towards my LCSW. But currently, I perform my therapy sessions under supervision until I get my clinical license. The first difference I would say between myself and like nurse practitioners and other medical professionals is that I can't prescribe medication. You guys could do that. So you guys know what you're doing when it comes to that. I leave that in y'all hands. Yes, we have training as far as like what different types of medications are out there and like what they do and whatnot. But we don't have the capacity or the capability to prescribe medication to people. So you guys, I would say, are more trained or more are more prepared to do that than we are. You know what I mean? So I would trust your judgment, you particularly. I don't know many other people.
I appreciate that.
Since I know you like that, I'm like, he knows what he's doing. Go to Dr. Nate and his team if you need that. But I would trust your judgment to see what is it that a patient would need. You come to me for the in-depth one-on-one or even couples or family group session, whatever it is that's needed. Psychotherapy sessions where we can sit down and we can like really dive deep into what's going on, right? So you would do like the introduction, sit down with them, see what's going on. Then you let me know, hey, I have this patient that came in, they're dealing with X, Y, and Z. I would love for you to be able to sit down and talk with them. And then we can give them that intensive care that they're looking for,
Right.
and then really try to get to the root of what is it that they've been dealing with,
Right.
so that we can work our way towards that moment of breakthrough, and then they can kind of see that shift that they've been looking for, and be confident that that shift is also going to make positive impacts in every other area of their life too, right? Yes, I would definitely say that that's really the major difference between myself as a social worker, because I want to be specific about what my background is in. I'm not a psychiatrist. I'm not a psychologist. I'm not a nurse practitioner. However, our background is, we're trained in very similar areas, especially in, with the foundational psychology and practices and theories and things of that sort. But we have very specific areas in which that we've been trained in, right? And then also knowing exactly like how to conduct these 45-minute, 60-minute sessions where we can really get to the meat and potatoes of what it is that you want to talk about.
Yeah. So I love that you just made this the least threatening way of understanding how it works, because I hope that it makes patients understand a little bit more when we make these types of referrals, that it's actually it's talk therapy, and it's a lot of work on the background that has nothing to do with medications when we're talking about mental health therapy and counseling, right? So I appreciate that insight. I appreciate you sharing that with all of our viewers today. And I hope that many of you guys got something amazing out of this today. The goal of this discussion was to make sure that when we do have the discussions in primary care, first of all, you're advocating for yourself, right? Because physical health, mental health, emotional well-being, all of these are interconnected, but also just understanding that if there's a discussion about possibly seeking therapy, that you don't automatically think this is medications or anything that seems weird in your mind or concerning, or it's the stigma that seems to be related to a diagnosis. So we hope that we were able to give you that for peace of mind for today. But thank you for joining us, Dr. Dexter Daniel. Thank you so very much for being here with us today.
You, Dr. Nate.
We appreciate you very much. Our healthcare community is so much better because we have you and all of our social worker colleagues and all of our LCSWs, LMSWs. My mom, shout out to you. Gotta shout her out.
My supervisor.
There you go. You're his supervisor. And we thank you all for joining us today at WeDriveHealth's podcast, and we hope to talk to you soon about other amazing topics. Don't forget to leave any comments below in our message or our comment section, and we will gladly continue to answer those questions. Take care, guys.
Scene 1, take 3.